360 Sides of Light will be shedding light on this unprecedented critical situation of corona that we all are passing through, and it will be shedding light very intimately on our personal and our family lives. It'll shed light on our community life, how we are keeping ourselves resilient, how we are keeping happy and healthy in the middle of all these challenges that we are facing on a day-to-day basis. Today, I'm joined by Patricia Maminsky, a retired psychologist and also community network activist. I'm joined by Farhana Ferdoz Mimi from Dhaka, Bangladesh, director of TIB, Transparency International Bangladesh. I'm joined by Farida Nasreen, a master teacher from New Jersey, Sultana Nasreen, GIS specialist living in Melbourne. And Patricia Maminsky is in Melbourne.
Hello, everyone.
Today, we are talking about a time when globally we have lost more than 1.34 million people. Totally 56.3 million, over 56.3 million people are tested positive, out of which 36.20 million approximately has recovered. Worldwide, it's not only corona, it's an ordeal. This year has been an ordeal of so many challenges. Natural disasters of all kinds, violence against women, racial conflicts like Black Lives Matter, and mental health issues, especially adolescent mental health issue, and the list goes on and on. Out of all these challenges, we haven't given up. We are carrying on with courage. We are carrying on with optimism. We are keeping ourselves healthy, and we are trying to keep our community healthy. We are maintaining all the restrictions. In today's discussion, from different parts of the world, we are going to share our ideas, our thoughts, and our good wishes. So just to know our participants a little bit more intimately, let me introduce to Patricia Maminsky, and let me get it from her. Patricia, what have you been doing as a psychologist, and what are you doing for the community now?
Well, I'm a retired psychologist, so I actually don't work as a psychologist anymore. However, years of training and experience have given me some good ideas about doing some community activism. And I feel very honoured to be among the women you've invited today. Thank you, Irfat. And our little group, which is about 16 strong, have set ourselves little challenges along the way to deal, because Melbourne has been in the world's tightest lockdown for 8 months, really. And we really needed to keep everyone's mental health afloat. So we have met weekly on Zoom meetings, and people have enjoyed that, and it's something they look forward to. And during that, thanks to you, actually, you set a challenge. You said, what are we actually doing? And we actually decided to do something to support Dan Andrews through this lockdown period, because it was very hard for everyone, and I'm sure it was very hard for him too. So in doing that, we had a couple of little projects that we've done, and it's kept everyone afloat, happy and anxious to join and talk every Friday. And I think that's really been quite good for their mental health.
Thank you, Trish. You have said it very nicely that through these challenges, how you are keeping up, is still doing the network and is still doing the happy hours. Now, Farhana, if you may say how you have gone into these development activities, into development organizations, and what are you particularly doing for the well-being of stakeholders in this corona time?
Thank you very much, Irfat. Hello, everyone, once again. This is Farhana. Already Irfat told about me. I am currently working as the Director of Civic Engagement in Transparency International Bangladesh. And I have already I have been in this field, that is the development It's more than 22 years, and it's a kind of happy memory for me that I would like to mention one thing, that is, I actually in my childhood, actually Dr. Muhammad Yunus, the Nobel laureate, he used to actually live at my neighborhood, and I actually brought up hearing the kind of words like the women's empowerment, cooperatives, and savings, this kind of issues. And my father and with his other colleagues always joined him to do the community works at the nearby village. So it was kind of grooming that worked actually for my kind of professional choice. And after my doing master's in public administration, I didn't even try for the government job. I started my career with the one of the largest organization in Bangladesh, that is Proshika. I started work over there, and I I worked with the number of national and international organization, and actually exposed with different kind of issues like the gender equity, water resource management, peoples with disability, children and adolescents issues, anti-corruption social movement that I'm working now with this. So this right to information, this all these issues actually for me actually I learned a lot and earned a lot as well. And after that, right now in my current position, I am leading a kind of it's about 6,000 volunteer network, especially with youth, and also joined by the senior people. And actually what we are doing now, that the very committed force of volunteers, they actually playing the watchdog role to influence the state's decision making process, as well as the what is the public service delivery, to ensure the transparency and accountability in the public service delivery. In the COVID situation, especially since March, what particularly we are doing as in relation to our actually vision and mission, we are tracking the COVID situation in two ways. First of all, one thing is the health systems, responsiveness of the health system, and the public service delivery means the institutional response to the health issues. And other one, it is the government already declared the cash incentives and few stimulus packages for the ultra poor. So how these actually is working, how responsibly all these programs are being responding. So we are looking after this one in 6 indicators. Those are the rule of law, responsiveness, effectiveness, participation, transparency, irregularities and corruption, and accountability. In these 6 indicator, we are actually measuring the responsiveness of the government. So it's a kind of what you say that we already published 2 kind of tracking report and shared with the government and media, released in media. And apart from that, our volunteer network, they are also doing many, what I say, that the kind of social works. For example, the relief distribution, the awareness about the health protocols, these kind of issues they are conducting by their own at their own community. So it's a kind of little intro from me and what we are currently doing here. Thank you, Ifat.
Thanks very much, Farhana. And along with this information, I would like to add that Farhana is a friend of mine, and we graduated from the same university, same year, from different departments though, and we were colleagues in Prashika as well, in 2 different departments. So now coming to Farida Nasreen, isolation is hard for anyone, any age group, and isolation for school going children has been harder. You being a master teacher, how did you manage? How did you manage making your teachers and your students go through this difficult time? Farida Nasreen. You You have to unmute yourself.
Okay, I didn't know. Thank you. Thank you, everyone. Thank you, Fred, for welcoming me and from USA. So I'm enjoying the conversation already. It's very in-depth understanding what is going on in Australia, in Bangladesh. Bangladesh, we know, but it's good to know from somebody really specialized in the area. So I'm a master teacher, as you heard, which is like instructional coach. I'm providing coaching for teachers, early childhood educators. I have been working like since 2011 as a master teacher, but before that, I was a classroom teacher for I think 7 years. So I came to this country like 1995, and I spent my time just to give you a little background that why I am in education here. I came from Bangladesh, of course. Finished my master's in physics from one of the top university there. Came to this country. I got married, and I have have built my family, my children, and then I decided to go for education. That was my choice. I did not pursue my career in physics or I also did my master's in computer science. I thought I'm going to be a programmer, but then didn't happen. Decided to go for spend time with children and give something to others. So as an educator here, it was difficult when it started this COVID last March when it locked down. It was difficult for as an individual and as a family, but think about as an educator to think about all those teachers and all those young children. It was really hard that time, but as time passed by, we just kind of getting used to the system. We are most importantly, we are supporting, like my role as a master teacher, to support the teachers, to support the children basically. So I'm working I live in New Jersey and working one of the fourth largest school district here, where like I would say 27,000 students and 51 schools in one district. So there are many districts, but I'm working in fourth largest one, and my district is predominantly Spanish, African American. I think Spanish population is more than 60%. Also, there are some, I think 5.6% from Asia, and even our Bengali, largest, Bengali community is there. So that was one of the reasons for me to continue there. So when it started, I kind of like, having the experience as a teacher and a master teacher and a mentor, I was able to guide my teachers with, first of all, like then, at the beginning, it was like they needed the support with the social emotional, like how to settle down with this new transition, how to everything shut down, started from remote learning remote learning from home. And children, those are young children, those are like pre-kindergarten, kindergarten. It was hard for them to stay home, and while they were learning through playing, now they are home, they don't have anything, that kind of environment is not there. So we started train our teachers how to do it through virtual platform. So we used in our school district, we used Google and Google Classroom. That's pretty much in New Jersey, we adopted Google. So a teacher has the Google Classroom, so it's a virtual learning experience. So in a way, we said, I help the teachers to set up the classroom in such a way where children are getting the same experience like in classroom. One good thing is here that we are having those parents involved, engaged all the time. They try their best. So that is the benefit, like to have parents there to help their children. Supporting teachers is, we know that every teacher, they're also going through so much, and especially that in USA the COVID number is way bigger than any other country, right? We have right now I think I think the number exceeded 250, more than 250,000 deaths. And it's heartbreaking that, is growing so fast that is hard to control. But at the same time, this country is like kind of like not stopping. They are doing everything at the same time while they are following the rules and guidance and everything. So in a school system where the teachers are teaching from home, so there is not really like, we don't have, our school district is pretty much everything from remote learning. So they are not going out, and a couple of school, they're doing half and half, hybrid, is called hybrid, So, but at this time, our school district, they chose to do the remote. My role is just to support the teachers, understand where they're coming from. So it's like building we have the relationship, but it's kind of reinforcing that kind of positive relationships with them to understand them, where they're coming from. Still, we are meeting the same expectations, however, in different ways. And we are learning by doing, because it's a new experience for everyone. So yes, there is way to communicate. Like I have my own Google Classroom. Like this morning, I had to present for 42 teachers, teaching staff. So again, it's all about, it was the focus on inclusion, how to include all learners in the setting. So again, we are doing everything. Nothing is stopping, but in a different ways. So my community is my school district, especially my department, where is like we have in my department, I have like 37, team members who are just like me as coach. And I have 254 early childhood teachers. So under me is like around 17 or 18, and I have a couple others. So again, we have a system that we go and we help them. We make sure that they are communicating with the parents. We are helping them to create their lesson plan, implement the curriculum. So as a coach, we are providing all those supports so that the teachers are not overwhelmed. That we are doing, and just to make sure that if the children are not there, they don't join the class, why they are family workers, they are social workers. It's a nice network. So we have a nice system. So it's try our best to keep things moving. And I have my own children. I can see that it affects everyone. However, it's like your willpower, like what you want to do. As long as you are following the guidelines of masking, washing hands, we are pretty much moving. So it's really, as long as you are in a safe side, our area where I live is not that affected. So we are just following we are moving on. Life is not stopping,
Yeah,
It's positive. I'm
fantastic.
looking at positively. So yes.
Yes, no,
Thank you.
fantastic. Yeah, managing a big number of cases, more than 11.8 million cases in USA is a massive number to deal with, obviously.
Yes.
So yeah, I can understand also lots of parents who have got school going children who are in elementary schools. They also find it difficult managing their children at home, who are having remote learning, and at the same time keeping efficient and productive in their own workplace. So some workplaces have been good that they have been flexible with the timetable, and they have accommodated their staff to work in their flexible hours. But some job demanded that you would be available in the standard time when all the other co-workers are available. So it has been a big challenge all across the world and in places where the cases are too high. Sultana Nasreen, you are working from home, and you are managing your life, which is a work life balance. And you were the other day talking to me about how things are turning into some positive experiences as well. It's not all negative, it's not all dire, how things are shifting their paradigms and moving to online interactions. So could you please tell us how you are doing this balance?
Thank you, Ifa. Thank you, everyone, join this program. I think this is a great program to share our, the pandemic time, how we can spend, because I think the Australia, one sense, we are very lucky because we have only, it's a big country, but population is not like big in the USA or Bangladesh and other country. The total case in Australia is still like today is maybe 28,000 all the total cases, and we know only 900 people maybe dead for the corona disease, and then 25,000 or 26,000 already recovered the corona. So I feel like we are one sense is very luckiest country because last 2-3 weeks there is no the new cases, but recently is Adelaide there is a new case coming again on a number which is nothing. So I want to share with you like last 7 or 8 months we are home, especially I work from home and how I can balance my life. I'm very positive person because I always try to find out how I make my time very positively. Nothing depression, nothing mental issue. So how I can manage my time properly. Actually, I just want to give you some of the research example, like what's going on in Australia, because the recent research, we just find out, the almost 80-90% people work from home, and the recent research show that the Australia is a 45% people are very happy because they make sense because it's a flexible of the life, that you can a lot of flexibility at home, and then 25% people think about okay there is a work-life balance, because if you go to the office and you don't have this kind of balance because we spend a lot of time in the road and then office, and now we can look after our kids, we have a family life, so how we can do this kind of things, and 4% people think about the travel time and other information, like how you spend your time, like the work from home, it is like less stress or lower travel cost, and you can save a lot of money. So this kind of things near to the age care, because I work in council and I'm a senior GIS officer, so I try to find out how I can keep my community healthy, and then they can go to the the parks and open space or playground or a sports area, so for exercise and everything. So I find it really interesting topic because I did my PhD last year, and this pandemic time actually I did a lot of research related to the the COVID, how impact in geospatial science, and last 3 months actually I just published one of the paper which is a book chapter from Melbourne University, based on the older people mental health issue in geospatial science, how we can the support them based on the where is the age care location or child care location, and people go to the playground and the other area. So these books is especially in a COVID time, how people struggle, health issue, and then social or socioeconomic demographic related information we published. So this is one thing I did, and this year actually my daughter gave the VC exam, so I spent a lot of time with her. This is the only 1 year I spend really good time with my family because it's a work-life balance.
A lot of people are utilizing this time together for reuniting, for strengthening their bonding, to make their family ties healthier. Whereas on the other side of the coin, unfortunately, there have been lots of home violence. And in these home violence, the statistics would scare you. 88,214 cases have been reported this year to Australian police. And that's 15.3% more than previous years. And out of the victims, 65% experienced physical or sexual violence. So these home violence and violence against women is not confined within one regional location, or it's not confined in one part of the world. It has been a problem. It has been problem not only in corona time, in other time as well, and in corona time it might have gone a little bit more severe than ever before. I can give you some more global statistics that 35% women experience physical or sexual violence worldwide. 137 women are killed by a member of their family every day. So I was shocked looking at the number myself. And 87,000 women per year killed globally, and 50,000 are killed by partners or family members. 30,000 are killed by current or former partner, and 10% of schoolgirls are sexually abused. Very unfortunately, in Bangladesh, recently there have been series of this kind of unfortunate incidents. I would like to ask Farhana, as an activist of development work, how you are addressing these next to the government.
Thank you, Irfat, for unfolding this kind of what I said, that a very tragic part of violence against women. In fact, if we just if we just think about the cause, that is the main cause is the unequal power relation in family, and their under evolution and non-recognition for their contribution. It actually it actually goes to both what I say, that the women who are working or who are not working, both. So, women who are working, they might be the a victim of less of these kind of issues, and but the women who are actually housewife or working in the home, and they are actually victimized of this kind of oppression. And in COVID situation, when we are working from home, it's about for 8 to 9 months. Some of us have very good experience, as Nasreen already mentioned. That is, yes, we are managing our life and work both very nicely, might be, but in some places it's not. It's a kind of different situation. Just let me share some newspaper review. And before that, actually, what I say that if we look at the violence against women, there are different sorts of violation. But that might be the rape, this might be the sexual harassment, murder, attempted rape, and different sorts of violations. So if I just share you the first 10 leading newspaper review in Bangladesh, that is from January to October 2020. That is the one statistics I can share. That is the rape case is about 1,349. Attempts to rape, that is 271. Death after rape, 46, and committed suicide after rape, that is 13. This is a very, what I say, the horrific figure. And in case of domestic violence, already the reported case, I'm sharing the reported case. There is lots of cases, those are unreported. So domestic violence, already 205 women murdered by their husbands or partners, and suicide case about 80. Sexual harassment case, that is 180 women harassed and 14 committed suicide. And acid attack or acid violence is already 24 women, they actually attacked by this kind of violence. And another survey is conducted by one of the national organization who are working already 127 partner organization. They have conducted a survey over 50,000 women, 57,000 women. And the result shows during the COVID period, especially since March to July, the result shows that the 9,844 women and 2,896,000 children, they actually exposed to different kind of violence. So the violence that I already mentioned, the source of violence, and the child marriage rate. Child marriage rate already it's a kind of worsening situation. This it's what I say, that that Nasrin Appa says and the Farida Appa said, it is the children actually are now at home and doing their classes, education from home, using the devices and something. But in our country, there are lots of poor and ultra poor children, though actually those don't have any kind of access to the devices and this kind of regular works, we can't even think of them. So sometimes for the insecurity causes, actually parents, they actually think that it's better to get them married, and so the child marriage rate is quite high. And because of the COVID fatalities or the COVID responsiveness, what I say, the managing the COVID situation, these kind of issues actually are being overlooked somehow. It's not actually in the what I say that the in the main course of discussion right now. So that's another problem right now. So this is in short. I'm sharing with you with very heavy heart, Irfat. Now it's over to you.
Okay, thank you. Well, at least you are trying to overcome these situations and trying helping people who are generally getting victimized in these unfortunate things. Sort of assurance that you as a community is working towards awareness building. Now, I would be coming to Patricia because Patricia is a retired psychologist and she has dealt with people of different mental health issues. And before coming to you, Patricia, I'm just giving some statistics once again, very precisely, that 970 million people are suffering from somewhat mental disorder, and that's 13% increase for COVID situation. 300 million people suffer from anxiety, and 160 million people suffered depressive disorder. 100 million people are suffering from dysthymia. So all these figures are not small numbers. These are not figures that we can even not be concerned about. Even though we are concerned about it, at the same time, it's good that government is taking initiatives. Government is doing lots of funding. There are other organizations who are trying, helping people in anxiety, panic, depression, anger, confusion, uncertainty, and the near future financial stress that people are foreseeing, or some of them are already facing financial stress due to joblessness and stuff like that. So, Patricia, do you think that we have got enough help in society? And as a community, what can we do to help each other?
The state of mental health in our country and in Victoria is really appalling. To get a place in a hospital, to get an acute bed, if you're suffering from depression or anxiety or psychosis, is very, very difficult. And a lot of the people that you find in prisons suffer from mental health issues and psychotic episodes, all sorts of things. And the statistics, and I'm not up to date with the current statistics, but when I was, it was 20% of people suffer from anxiety. So in a room of 100 people, 20 of them are anxious. So it kind of brings it home to a closer to you, if you understand what I mean. 2% would be psychotic. So 2 of them would be battling with schizophrenia or other psychotic, psychological and psychiatric problems. So it's really quite frightening. And the fact that the government is currently putting a lot of money into mental health is a really good thing, but it's way overdue. And a lot of that money is going to Headway, Headway, which is a youth program for mental health. And when I worked, essentially, I was the manager of a clinical program with Connections, where we had 8 psychologists and 4 interns. And we mainly worked with children and trauma. And trauma is and early childhood trauma actually exacerbates adult problems and leads to a number of emotional events later in life, which is really interesting to know. So with any luck, this injection of funds should help, but we definitely need more acute beds in psychiatric facilities and in our hospitals to deal with the people who shouldn't just be admitted overnight and let go. They really need a treatment program, and they need support in the community when they are let go, and often that doesn't happen. So I think it's really concerning that we have this problem, but it's good that they have started to inject some money.
Thank you. Thanks, Trish. Now, Nasreen, in your connection, do you have people who have lost jobs and who are scared of losing it? They are suffering from uncertainty. And do you think, as an Australian, do you think that we have got enough initiatives to bring these people back on track, even if you want to put it in the context of immigrants?
Okay, thank you, Ifat. Actually, what happened, the Victorian government take the big initiative when the COVID is start, like, the last February and March, a lot of people start to job when is the quarantine is happen and then restricted is going on, because I think the all wide, the Victoria is one of the restricted place, like where we have like almost 7-8 months we are at home. And a lot of people lost their job, but I'm not worried about Victorian job placement, because the almost 500 million working for Victoria initiative take the job. So and another thing is Victoria part of the Victorian government, like 1.7 billion economic survival package. So it's a big amount of money government already spent for the job seeker. And the who don't like a lot of factory, a lot of the hotel and other places is closed, but this is called like employee cannot go to the work, but they are job keeper, so they can keep their job, and they got the the fortnightly almost $100-500 from March to like September. And then government extend this job keeper salary almost like the 1,200 now, and I think it will be extended like next March or April. So that means a lot of company and then small businesses and other places is closed, but government take this one is a job keeper, so they can get the continuous money. So this can help like support who can go to the job, but at least they have the money, like the continuous coming. So I don't think so like big effect in a mental health issue or these kind of things, like and another question is like job seeker who don't have the job, what government take the initiative, like local government, federal government, they start to hiring a lot of people even though they don't have an experience. Because I just want to share with you one of the knowledge, because I work in local government, and our council we already hiring like 350 people, like it's a huge number, and most of the local government they are hiring a lot of people, and state government give this the funding, and it is just 6 months. So that means people are very busy, because this COVID time, a lot of people are here, or they have a frustration, they can't do anything. But this COVID time, I'm very busy, because in or like my personal life and my office, because the one thing is a lot of people are hiring, and we need to give them the training, and then they do the job in online. So we have a very good practice, because every day we just log in our machine, and most of the local government, they just see how many people are affected, we work from home, if this COVID is affected or not. We apps in, I think maybe more than 3 million people, like that they are starting like, using the COVID apps. So right now, actually, the job situation is not bad, but I want to share with you the one thing is the university, because a lot of outside people, like who are the international student, they back to their country, and some still is here. So university like professor and senior, the associate professor, they are lost the job. So this is the big amount of people. Is not like small. Another things is, I think the university can organize a lot of funding, like the like full funded scholarship for masters and PhD. So I think next year it will be come back again. But right now, government take a lot of initiative for the job seeker place who are looking the job is, and people are still like getting the job who don't have any opportunity. And I think maybe December, a lot of restaurant and small business they open. And another biggest opportunity in government provide the support is a grant. If you see the state government grant, there is a lot of local government grant. You can start a small business and then take the initiative, do the research and other things. Is TAFE and other organization, government can fund, like the free study. Some place you don't need to pay anything. So I think there is, like, I know, like other country, what Farhana said, like Bangladesh, there is a lot of people are struggling with the the job stress and a lot of social issue. But still, I feel like we are at the right place, and we got a lot of support from the government. Yeah.
Okay, thank you. In this context that people are losing job and they're in fear of losing, and also immigrants are on and off getting sad news coming from overseas that someone in the family or extended family is passing away. So in this COVID time, how immigrants are facing this job situation in USA, if you can tell us a little bit, Farida, precisely.
Thank you. This is a good one. It's a difficult time for sure. For America is not at this time. It's not the same America looked like 8 months ago. Absolutely not. I can start, from my own experience from my household. We are 4 of us. My son, my husband. At this time, they're not working. However, we are very positive. There are opportunities. So, and I just want to add to what Patricia said, that the mental, distress, mental disability, or all those anxiety, fear, this all takes place when you are, financially having a struggle with your children, and many factor comes to take place, that affect people, not mentally well-being. So again, I strongly believe, like, me and that's my sister. I think we didn't say, me and Sultana, we are 2 sisters. So I like to say that I think education matters. When you have the right education and the values, even it doesn't matter like where you are coming from. I think the proper education helps. It helps us to go through this time. It's difficult time. Just like me, there are many other immigrants are living here, and pretty much more or less everybody has some sort of same kind of situation. So I think that matters. Like when people struggle, like family can come together, help each other, and with that you need some sort of when you have that kind of values, that you don't let anything to affect, is a short time being, and keep your faith and move on. I would definitely say that. And again, in the education, in the school, in education, that what Farzana said, that in Bangladesh is completely, it's like comparing with apple and orange, right? Whereas in USA, like I work in, as I said, that very urban school district, which is a low income area, one of the lowest income area. They don't have, they are living, many of them are living with a food stamp and things like that. However, the school district, the state, they make sure these children get the same kind of education like any others. So in March, when it started, I think towards the end of April or May, we start like the district funded by the state to give each child, think about those 4 years old and 5 years old, they, thinking about them and their education, make sure that they're getting the right education. They provided with each child with a Chromebook. Think about, we have 2008, like almost 2,900 students, preschool students, like 4 or 5 years old, they received a Chromebook. And along with Chromebook, they received a bag full of materials that goes with developmentally appropriate learning experience, during that time. So again, it's unfortunate, like, our country, that people suffer, and people do not look at those, and that affect the whole system. And also, I would say that the way our, like, as I said, that how we grow and raise, Farzana talked about in Bangladesh, the social economic, right? Farhan, I'm sorry, talked about how, all those violence and, how women are suffering. Even it's not only the poor, or only not the, low income or low, it's not that. It's high class, upper class, highly educated women are being affected. And it's just sad. And honestly, again, with our values, the way we raise, just that little bit of thing, and whatever we are receiving from here, keeping our eyes and ears open to see what is available here and take the most out of it to help others. It's not, I may not able to help a bigger, community. However, just to talk to each other, help each other, it helps. It just, I'm raising my own daughter who is 18 years old. What to do here at this time? Staying at home 18 years, it's not easy. So what kind of tools and resources I can give her so she can, she can be mentally well-being and, pass through this time. I think our education system is just, is, I can say, but I think it's need to look at a bigger way, that how can we change that, and how can we help all women, not only, different levels, help others. Yes, and as an immigrant, I would say it's the same thing. Here, as an immigrant, I think it looks different from, home to home, families to families. People lost job for sure, but there is a support system from this. There is stimulus package. They are, getting paid, not a lot. There are news, but nothing is drastic that, people are, it's gonna be, if it's going the same way, like, whatever is happening last few months, if it's continue like that, then it may hit badly, but it's moving. And we have, as you heard, that, we just finished, in US just started election, and there will be a change in the government, so that may bring some kind of, but coronavirus, the vaccine is already there, almost there. I just heard the news today that there will be like 45 million vaccine will be ready by the end of December, and it will be distributed based on the need. It's not like who comes, who first come first serve, not that basis. It will be by need basis. So
yeah. And in that need, they have mentioned people who are more prone to get affected, like medical practitioners, social workers, teachers.
Essential
Who are in
workers.
close contact with the beneficiaries. So that's excellent. Thank you so much, Farida. And I really loved what you said, that keep faith and keep hope and keep it within in your heart, and also communicate it, transmit it to others, so that you are inspiring others to keep positive and help. Even if it's one person, still help each other. Thank you very much for that.
Thank you.
And
Thank you.
and you have covered vaccine, which is also beautiful because I was just about to say that even though we have spoken about lots of issues, lots of problems all around the world, but the ultimate note is that we are moving on and we are keeping optimistic. The point that we were making is yes, the whole time has been an ordeal. And also, on the top of every problem that we have spoken about, even though we are not directly hit by those natural disasters, but worldwide, we had earthquakes. Earthquakes in Turkey, Caribbean, China, Iran, Russia, Philippines, and India. We had a big volcano in Philippines and 2,484 volcano tectonic earthquake was there. And in devastating flood in Indonesia, 4 lakh people became homeless. We were just around the time of COVID-19, we had Australian bushfire. And in Australian bushfire, 18.6 million hectares got burned. We lost uh, so much wild animals. We lost our land. We lost our buildings, and 400 people were killed out of that bushfire. So, out of all these ordeal, we still have been very resilient worldwide, and that is the message of hope. And we are saying that we are not giving up. Now, to give that one line of hope to each and everyone to say, keep happy, keep healthy, keep safe. I would like all of you to give one line. Patricia, you first.
All I can say is that we've endured, we've survived, and we will continue to survive because people are resilient. Essentially, they are resilient, and we will make it through this together with networking and people like you helping. So thank you, ladies. It's been a wonderful experience.
Thank you, Trish. Thank you. Now, Sultana Nasreen, one line for the audience, please.
Okay, I want to think like, the COVID time, I just learned only one thing is if you're only one happy person is nothing happiness like so if we all together work together, then happiness is coming from like everything, like together.
Thank you, Nasreen. And connected to that, I wanted to also share this information that there has been a talk of providing vaccines for free to those underdeveloped countries where most of the people wouldn't afford to buy vaccine. And like you said, that in isolation, you cannot keep safe. If you want to save the world, if you want to save the humanity, it has to be the entire world. Now, one line from you, Farhana.
Thank you, Ifat, for a fantastic program. I think we had a very useful discussion, and it really hopeful. If we have to keep on moving, okay? So we have to cope with the new normal life. We have been exposed with very new terms like isolation, like social distancing, like lockdown. So all are negative words. So we have to find something positive out of that. We have to win the journey and we have to win the battle. Thank you very much. Thank you,
Thanks a
everyone.
lot. And now, would you please, Farida, give a few words for our audience?
Thank you. Thank you, Fred. I would say stay positive and be flexible. No matter what situation comes, you know yourself, believe in yourself, and love yourself. Know your surrounding. Be aware of the situation, and just to help each other as much as you can. At the end of the day, it will just bring the joy and happiness to your own life. When you are happy, then you can see the happiness to other people. So thank you so much. I enjoyed, and I hope to see you again.
Thank you very much, each of you, to make this time to connect with each other and to give these kind word to each other and to the wider community out there. And the last line from me is for my audience, everyone that is going to watch this program, this discussion, that it's one planet, one Earth. And I wish each of your life gets 360 sides of light and it gets bright to brighter. Thank you very much. Thanks once again for being with us.